What's going on, guys? I want to first off, my name is Idel Dominguez, and I want to take this opportunity to share this article that I came across, Medical News Today. It mainly talks about the side effects of taking metformin. It's a very long um, article. I'm not going to go through the whole article. I just want to pinpoint this one section on this article. As you can see, it says side effects of taking metformin. As a diabetic, I was able to get off this medication through a very strict diet. Once again, I want to mainly touch up on this part of this article. Okay, side effects of taking metformin. For those of you who are diabetic, especially type 2, you may consider um, getting off this medication. However, I do want to make a quick disclaimer. I'm not a doctor or an expert by any means. However, I was able to get off this medication um, through a very strict and natural way. Neither am I suggesting you to get out of this medication. Okay, now let's continue. Like I said, this medication puts you at a risk of side effects. Let me clarify this. Okay, metformin is an effective treatment for type 2 diabetes. It will help you lower your glucose or sugar levels. However, you are at a risk of these common side effects, which is digestive problems, diarrhea, vomiting, flatulence, which is a form of digestive problem, lack of vitamin B deficiency. So if you're basically feeling weak, that's because you're probably deficient in B12 vitamin. Now, however, if you're trying to lose weight, this can be beneficial. Okay, I'm not saying that these side effects are going to happen to you, but you're at a risk. It could or it can't. So it all depends on each individual. And once again, this can happen to you. You are at a risk. Now, here in this section, it does recommend you to, okay, a person should talk to a doctor before stopping metformin treatment. Taking the medication with food reduces the risk of a digestive problem. Okay, there you go. Now, however, not everybody, but around 30% of people taking metformin in the long run may experience vitamin B deficiency. Once again, weakness, shortness of breath, nerve damage. This right here is very important because if you don't keep your sugar level or glucose on check in the long run, you may suffer from nerve damage, which can lead to maybe amputations. It could be on the feet, on the hands, etc. Now, those are the main and common side effects, which if you can deal with that, you're fine. However, I want to touch up on this right here, which is the less common side effects. Okay. In some people, metformin causes blood glucose levels to drop too low, and the medical term for this is hypoglycemia. Okay, as we all know, not eating right or taking care, especially if you're diabetic, your sugar can skyrocket. In the long run, it can be very, very bad for you. Now, on the other hand, taking this medication, metformin, can lead to the opposite, which your sugar level can drop too low. The same thing, if it's too high or too low, it can be dangerous. And it might be life-threatening as well if you don't take care. So it can also drop, which is hypoglycemia. Now, there's another two situations that may occur that you can be at risk of, which is okay, there is also a very low risk. It's a very low risk, but you're still on that risk, especially taking this medication, metformin. It's a condition called lactic acidosis, which is a heart situation. It can put you at a risk of heart problems. So that's one reason to actually consider getting off this medication. Now, all right, okay, certain people taking metformin may also have a risk of kidney damage. Okay, just to make sure and to clarify, just by simply being diabetic, taking metformin out of the equation, you are going to be at risk of a heart problem and kidney problem or damage. Now, if you're taking this medication, metformin, it's going to put you at an extra risk. So that's another reason why you should consider getting off this medication. Now, once again, I'm not saying for you to get off this medication. I'm just explaining the risk of taking this medication. Now, if you're a type 2 diabetic, there is a way to get off this medication safely, but you have to be very strict in your food intake, in what you eat, and you have to be strict in your diet. Now, if you want to learn more about this diet, because I'm actually diabetic type 2. I'm off this medication and I'm actually doing it naturally. If you want to know more about the certain diet that I'm actually taking, I'm gonna drop the my personal website down below at the description so you can check it out. If you have any questions or concerns, please let me know and and see what I can do for you. See if I can help you out. Now, once again, this website, I'm gonna drop it down below. I'm gonna drop the link below so you can as well, so you can check it out. The full article on metformin. So, guys, I hope this video was helpful and valuable. Once again, if you have any comments, please don't hesitate and drop it down below. Thank you.